Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. This month's theme is No Bones About It. Today's example is a 4.5-year-old male-neutered greyhound who presents for acute non-wearing lameness in the left hind limb after a game of chase in the park 9 days ago. He has been splinted in the meantime prior to referral. He also has an abrasion of the dorsal pes, and his entire pes is swollen. We're going to begin with the medial lateral and dorsoplantar views. Initially, we observed the soft tissues surrounding the entire left tarsus are increased in volume, and especially along the left lateral side. A small, well-defined semicircular mineral opacity is observed along the medial malleolus of the left tibia. It has a smooth distal contour and a sharp, well-defined proximal contour. A small spur is seen over the adjacent medial malleolus. The medial aspect of the left tibiotarsal joint is mildly widened in the neutral position. Multiple fracture lines are observed along the proximal aspect of the left fifth metatarsal bone, resulting in a large triangular fragment that is displaced proximally and multiple smaller fragments that are less well defined. Another large fragment is oval shaped. Additionally, there is some periarticular new bone formation seen at the dorsal aspect of the joint margins of the tarsometatarsal joint. Medial aspects of the second metatarsus and central tarsal bones are mildly irregular in contour with mild new periosteal bone formation. Now we're going to move on to stress views to assess whether or not these fractures result in instability of the joint. When a stressed view is applied to the dorsal aspect to evaluate is there increased laxity in extension, we observe that there is no change in the dorsal aspect or widening of the joint spaces of the tarsus. When additional stress is applied to the plantar surface to hyperflex the plantar surface of the joint space, we observe that there is increased width of the plantar aspect of the tarsometatarsal joint space, increasing the angulation of the tarsus. When a lateral force is applied to the lateral aspect of the pes, resulting in medial stress of the joint, there is not increased widening of the lateral joint spaces. However, when a force is applied to the medial aspect of the pes, resulting in a lateral stress of the joint, there is widening of the medial aspect of the tarsometatarsal joint spaces and a slight step of the lateral aspect as well. A full series has been performed of the right tarsus and pes and is associated and principally observed is some mild degenerative changes. So those images are available for your review. Our primary findings in this case are severe instability with subluxation of the left tarsometatarsal joint with associated fractures of the fifth metatarsal bone that is specifically comminuted and articular, with suspected dorsal, third, or fourth chip fractures of the metacarpus. A fracture of the proximal aspect of the second metatarsus cannot be entirely excluded, and there is pre-existing osteoarthrosis of the tarsus. An avulsion fracture of the left medial malleolus is present, and there is not evidence to support concurrent instability in the stressed views. There is severe associated soft tissue swelling, which can represent both hemorrhage or edema. The findings of this study are consistent with plantar and medial instability, and this can be due to ligamentous insufficiency or loss of stability across the joint space from the fractures that are present, effectively creating laxity in the ligaments that are providing support to the osseous structures. Although no concurrent instability of the tibiotarsal joint is seen, the fragment is suspicious of avulsion of insertion of the collateral ligament, and typically weakening of some of the ligamentous support would be anticipated. Computed tomography may provide a more complete characterization of the fragments, while high resolution and highly skilled ultrasound can also provide more insight to the soft tissue structures, specifically some of the parts of the medial collateral ligament. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.